okay. Don't be scared. Mark, are you ready? You sure? Can you tell me? Wait a sec, Mark. Sorry about that. Good afternoon. This is the Thurston County Board of Health for January 9, 2018. I'm Commissioner Bud Blake, Chair of the Board of Health this year. I'd like to start off by doing introductions into 2018 by announcing Commissioner Gary Edwards, Commissioner John Hutchings. The clerk of the board is Lydia Hodgkinson. To her right is the Director of Public Health and Social Services, Shelley Slaughter. To her right is Dr. Wood, who's the Health Officer for Thurston and Lewis County. And to her right is the County Manager, Ramirez Chavez. So with that in mind, I'll call the meeting to order, and I'll ask the board members of their approval of today's agenda.
I move to approve the agenda for today.
Second.
It's been moved and second to approve today, January 9, 2018 agenda. All those in favor say aye.
Aye.
Aye, and that motion carries. The next item we have is to approve the meeting minutes for November 14th, 2017 and December 6th, 2017 special meeting. Is there a motion?
I move to approve the meeting minutes from November 14, 2017 and December 6, 2017 special meeting.
Second.
It's been moved and seconded to approve the meeting minutes for 14 November 2017 and December 6, 2017 special meeting. All those in favor say aye.
Aye.
Aye, and that motion carries as well. So we have one presentation today, and it's a very, very special presentation for us that it affects everyone here in Thurston County, and it's National Blood Donor Month. And we have a really good program for you as far as the great staff from Northwest Blood Works. We put it together kind of the last minute over December, just because we want to make sure we recognize those who've done a lot of effort in terms of getting out and asking people to donate blood, especially in light of the recent derailment of the train incident up there around exit 114, just across Thurston County into Pierce County. And then, of course, any time we might have a catastrophic emergency, be it a natural disaster or what have you, and just in day-to-day operations, we need people to come forth and donate blood whenever you see the Northwest Blood Network's staff and team members out there. And so with that in mind, we have Mr. James Moore. I'll call him up in just a second. He's the Center Supervisor for the Thurston County Northwest Blood Works. And he is going to give us a little bit of background and tell how his staff has been operating here for a period of time, a number of years. Before that, I'm going to ask the Director of Public Health and Social Services, Shelley Slaughter, to give a little bit of background as far as Thurston County specific, maybe a couple of facts, and then we'll go forward. Shelley?
Thank you, Commissioner Blake.
Yep.
I should ask the Board of Health to proclaim January National Blood Donor Month to increase the public understanding of this very important cause and urge citizens of our community to donate towards this life-saving cause, which you're going to get to hear more about. Each day, life-saving blood transfusions are needed in hospitals and emergency treatment facilities across the U.S., including right here in Thurston County in our community. One victim in a car accident can need up to 100 pints of blood. And so in Thurston County, we have 109 county residents that are hospitalized each year in a car accident. So what this leads up to is 10,900 pints of blood each year for this alone. This is very important. There's lots of reasons that people need blood. I know in my family, I had my nephew that was in a severe car accident this summer and had a severed artery. Donation of blood saved his life. So it's very important. I'm very happy to have our speakers here today and to share more about what you do for us here at Thurston County Blood Donation. Thank you.
Okay, so hi, how are you doing there? Come on up and tell us a little bit about the Thurston County. Sure. All right. Have a photo.
Oh. So I wanted to thank Bud Blake and the county and the Board of Health for the recognition of the important role that BloodWorks Northwest, formerly Puget Sound Blood Center, plays in the community. We've been here for 20 plus years and continue on with our mission. I want to extend that thanks to the community at large because our operation relies on the support we receive from volunteers and donors each day. Individuals such as Linda Lutz, who has been supporting us for 15 years as either a donor or volunteer. And out in the community, she's a well-known midwife, so she's helping to bring the next generation of Olympians and blood donors, hopefully. I also like to thank Rich Green, who and his wife Jan, who has helped us for some years, either as volunteers or donors, leading our advisory council, and so many different ways. Virgil Clarkson, who's a friend of Bloodworks Northwest, longtime donor, and you guys probably know him as the Mayor Lacey, as he was, and so many others, and donors and volunteers. The recent train derailment was a sobering reminder of the power of our community in Olympia. Our center weathered the busiest day in our history of collections, and it was really amazing to see. Oftentimes, Olympia is overshadowed by our neighbors up north, but I can attest and truly say that the heart of Western Washington resides in Olympia, from what I've seen. The altruism demonstrated by our community in the face of a tragedy is truly inspiring and continues to be. Unfortunately, our mission continues, and tragedy strikes many families in our community each day, either through diagnosis of disease or trauma. I know our neighboring police department is currently managing such an event, and my heart goes out to Deputy McCartney and his family. I hope our mission at Bloodworks Northwest goes to honor our local heroes and each and every patient in our area, and I'm excited to see what we can achieve in 2018 as a community. And so I appreciate your recognition today. With that, I'll pass it over to Brandy. Would you like to say a few words? Brandy is currently our volunteer coordinator for the Blood Center. And yeah.
Hi, thank you for having us today. I'm here to say thank you to our volunteers. Not only do we have donors and volunteers with us today, but during the wake of the train derailment, it was imperative to me. The first day that I think we were open almost 14 hours collecting blood until 10:30 that evening. Wow. It was amazing. Jeez. And it was also humbling to see a community of over 150 donors come together, stay 7 hours, and luckily I had volunteers that just literally walked in the door, said, "What can I do?" And they were amazing. They helped to feed the donors that were waiting, and they helped triage and make sure that everyone didn't get forgotten. And it was beautiful. So with that, I would say thank you to my volunteers, to Bloodworks Northwest, and to you guys for honoring us and making January National Blood Donor Month. Thank you. I'd like to introduce Lynette Manning. She is our mobile recruitment. She's also the gal that had the bloodmobile in the parking lot today. She's the gal responsible for that.
That's what we want to talk about.
Thank you, you guys.
15 minutes are up.
Hi, thank you so much for having me today. This is a great honor for our company to receive this proclamation today. I just want to kind of stress on the need for blood donations. You know, we do need approximately 800 units a day just to keep up with inventory levels here in Western Washington. Myself personally, my mother and my nephew have both been recipients of blood. I get to have more time with them because of people just taking 45 minutes to an hour out of their day to give. So it's great. You know, I was there that day on Monday when the trail had derailed at the center, and the phones were just off the hook. So myself personally, I was getting lots of calls from community businesses and organizations trying to help and schedule blood drives. So we were there until 10:30, 11 o'clock at night. It was wonderful to see people waiting like 5-6 hours. You know, I tried to get them to schedule other days, and they wouldn't leave. They wanted to stay. They wanted to wait it out and help. So it was an amazing thing to be a part of. So I'm hoping that with the number of people that came out, we had over 100 a day for that week, that we planted some seeds because we had a lot of first-time donors. So the moment we get them in, we're hoping that they continue because, as James had mentioned, our mission continues, and we want to make sure that we are prepared for tragedies such as what happened on the train. So thank you so much for having me today, or having us today, and for allowing us to have a blood drive outside. It worked out really well. Thank you.
We got questions.
Oh, okay.
Oh, not necessarily a question as much as a comment. I know the board took the opportunity today to go out and donate, so got my card.
Yay!
And the reason I really had to do it, not only through all the hard work that you folks do, but Virgil Clarkson showed up, and here he's got
He's a
well
convincing
over
man, yes.
200 units, and it makes a person like myself feel pretty bad. Although I've given blood over the years, I've not even come close to competing with Virgil. So little competition won't hurt any of us out there. And I think it's a very good cause, and thank you for everything you do.
Of course, thank you.
Oh, that competition? You beat me at 6 whatever? Tell them about that, okay?
Well, that's because I gave up my blood almost a minute faster than...
You're older than me. Darn, how'd you do that?
Okay.
I also gave, and thank
Thank
you
you.
so much for putting this together, helping us put it together. I'm going to turn to him for a question, but before I do, tell us a little bit about when I was listening to the gentleman out there speak, the ideal way of, quote, giving blood. Sometimes you get a rush of people and you ask them to come back later on. Just kind of walk us through that operational portion if you can, so that people on the camera or on the YouTube can hear that, so they get an idea that, yeah, that you could be there all at one en masse, but there's also other ways of giving blood. So.
Oh, sure. Yeah, so, you know, it helps for people to come in and set up appointments so that we can manage that donor flow. There are times where we get a great turnout, and so we will ask if you can come back later that day or later on in the week even. As I mentioned, the need is always there, so if you're not able to give today, giving tomorrow is still going to help those patients that need it in the future. So definitely going to our website and setting up appointments is helpful. You can give whole blood. We also have different types of products that you're able to donate. We do platelet and plasma donations at our center locations. And what those are is, as a platelets is a clotting factor. A lot of cancer patients actually receive those. And they have a shelf life of about 5 days. So that's something that you can give every 7 days, up to, I believe, 26 times a year, 24 times a year. So that's a product that you're able to give. Plasma, if you happen to be an AB donor, they are the universal donor for plasma. You can give that at our center. That takes about 40 minutes or so. I'm not sure if I'm answering the question correctly.
You are, exactly, yeah.
Okay.
And then the other thing I would ask is just whole blood. Once you did that, how many weeks or months do you have to wait before you can
Oh, sure. So it's every 56 weeks you can give whole blood. 56 days, sorry. That's why I don't come alone.
Okay. That's good. Do you have a comment or question?
I think it's interesting you're talking about blood donating, and you talked to our donors, and you talked about the blood donor flow. Mm-hmm. Interesting choice of words.
Yeah.
You said that there's 800 pints a day that's needed.
Correct.
How often do we meet that or not meet that goal?
Well,
Do you know?
I don't know the exact, to be honest with you. I do know that this particular time of year, the holiday seasons, as well as summer, tends to be very difficult for us to get close to that goal. There's just a lot of factors that come into play. People are on vacation, so they're traveling. High schools actually make up roughly about 18 to 20% of our donations. So in the summertime, when those schools are out, we tend to kind of hurt for our inventory at that time. So I would say that we try to meet that goal. It's definitely more difficult in the kind of the holiday season in summers.
And you brought up a good point. What's the age limit?
Sure, you can be 16 or 17 years old to donate with a parent permission form. It's one of the BloodWorks Northwest permission forms. 18-year-olds and older, you don't need that. And 18 years old to do platelets or plasma donations.
Beautiful.
Yeah.
Thank you.
You're welcome.
Yeah, we bring Virgil up. Is he going to speak?
Oh, Virgil, do you want to say something?
And we have a Seattle rep right next to you. And a Seattle rep right next to you. Okay. Thank you.
Thank you.
So here's the proclamation, National Blood Donor Month. Whereas President Richard Nixon, in the December 31st, 1969 Proclamation 3952, the document that made National Blood Donor Month law, he praised the generosity of the American people, declaring, and I quote, "No manifestation of this generosity of spirit is more expressive, and no gift more priceless in time of personal crisis than the donation of one's blood. The voluntary blood donor truly gives life itself." And whereas the National Blood Donor Month has been observed in January since 1970, with the goal of increasing blood and platelet donations during winter, which is one of the most difficult times of year to collect enough blood products to meet patient needs due to inclement weather, often resulting in canceled blood drives, and seasonal illnesses like the flu may cause some donors to become temporarily unable to donate. And whereas every month in the United States, approximately 39,000 units of blood are required in hospitals and emergency treatment facilities for patients with cancer and other diseases, for organ transplant recipients, and to help save the lives of accident victims. And whereas every 2 seconds, someone in the United States needs blood, and a single car accident victim can require as much as 100 pints of blood. And whereas the blood used in an emergency is already on the shelves before the event occurs, so blood donations are needed more than ever after large-scale emergencies, especially since it cannot be manufactured and can only come from generous donors. And whereas an average of 6.8 million blood donors give in a year, but only an estimated 38% of the United States population is eligible to donate blood at any given time, with less than 10% of the eligible population actually donating each year. Now, therefore, be it resolved, the Board of Health hereby proclaims January as National Blood Donor Month to increase the public understanding of the importance of blood donation and urge citizens of our community to donate towards this life-saving cause. Adopted this 9th day of January 2018, signed by your Board of Health.
So if I get the Northwest Bloodwork team to come up here we'll make a little horseshoe formation and get a photo.
Smiling faces. Everybody.
Oh, is that right? Mine was 6 minutes, 49 seconds. You ought to put that up there. You ought to put that up there. Put that up there.
Mine was 5:28 or something.
Oh, is that right? Oh, wow. That is funny. How didn't you think about that? Goodness gracious. Okay.
Great balls of fire.
Yeah. Okay, so the next item we have on the agenda is number 3, which is the opportunity for the public to address the board. And I'm going to ask Romero or Brian, can you see if there's anybody that signed in as far as the... No? Nope, okay, just want to make sure. So there's nobody here from the public to address the board. So we'll move to item number 4, which is our departmental items. Number 4, and so on number 4 and 5, kind of do some administrative framework that we need to do before we even get further into the process. So it is the election of Board of Health officers for the 2018. And so are you framing this, Shelley, for this portion, or just the self-nomination? What do you want to do?
No, just your self-nomination.
Okay. So with my 2 seatmates, is there a nomination amongst ourselves to elect the chair of the Board of Health and the vice chair and the commissioner?
I would make a nomination if allowed.
Yes, we got the board.
I would nominate yourself as the chair.
Wait, so you got to say my name.
Bud Blake
Okay,
as
good.
the chair. And Commissioner Hutchins as the vice chair. Am I allowed to do that?
Yeah, you did it.
And I'd like to remain as a commissioner.
Okay,
That's okay.
that's kind of the way it goes.
Is that a motion?
Yeah, I guess so. If I'm allowed to make a motion.
I second it.
Okay.
Okay, so
We're good to go.
it's been moved and seconded to nominate Bud Blake as the chair of the Board of Health and John Hutchings as the vice chair of the Board of Health and Gary Edwards as the commissioner of the Board of Health. All those in
For
favor say aye.
2018.
For 2018, yes.
For 2018.
Yeah. For 2018, all those in favor say aye.
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 Aye, and so that motion carries. Congratulations, we got that out of the way. Okay. We will not conduct business that way forever and ever, though. So the second item is another annual requirement that we need to do in terms of when we get a new director, comes on a board, and we need to have the director of Public Health and Social Services be appointed as the administrative officer. In doing so, there's certain duties as far as RCW 7005040 and 7005070. And so with that in mind, is there a motion to appoint Shelley Slaughter as the administrative officer and the duties as appointed?
I move to appoint Shelley Slaughter, the director of the Thurston County Public Health and Social Services Department, as the administrative officer for Thurston County Board of Health pursuant to RCW 70.05.040. As the administrative officer, Ms. Slaughter shall administer the operations of the Board of Health, except for duties assigned to the health officer as enumerated in RCW 70.05.070. In addition, Ms. Slaughter will supervise and direct the local health officer in the performance of her duties. Ms. Slaughter, however, will have no authority to hire or remove the health officer.
Second.
It's been moved and seconded as stated. All those in favor say aye.
Aye.
Aye, and that motion carries. So the next item in the department item is we have a very good presentation from Leslie Price, who is our nutritionist for Thurston County, and it's going to talk about, give us a little bit of background about eating disorders. Is that correct, Leslie? Yeah, we've done this before, but it's super interesting, isn't it?
Yeah. I'm actually here to introduce the presenter. I'm
fun.
Leslie Price, the public health nutritionist at Thurston County Public Health and Social Services. Here to introduce Lori Schetzelhill. Lori's been the lead dietitian for the Emily program since they opened 3.5 years ago. The Emily program is a treatment facility that treats all types of eating disorders. Prior to that, Lori had a private practice in Olympia for 20 years. I've actually known her for that long. As well, she has opened new outpatient nutrition clinics at 3 hospitals in 3 different states. She's provided workshops on eating disorders, sports nutrition, and all sorts of topics to Thurston County schools, St. Martin's University, the Evergreen State College, and employees at many state offices and businesses over the years. Lori is a certified eating disorder registered dietitian specialist through the International Association of Eating Disorder Professionals and has treated eating disorders for over 20 years. Lori?
Hi, Lori.
Hi, it's good to be here. Yeah, Leslie asked me to talk, and I thought, great, I'd love to do this. Obviously, eating disorders are close to my heart. They are definitely a mental health issue that we need to all be aware of, and so I'm happy to speak about them, talk a little bit about them, and how they affect our community. You know, we usually think of people with eating disorders, and we usually think of anorexia nervosa. We think of like bony, skinny, thin person that we can just identify. And actually, that's so not true. Many of my clients over the years have been normal weight clients and severe anorexia. Likewise, we can't assume that people who are overweight have an eating disorder either. But in the treatment of eating disorders, the whole range is from anorexia and maybe very thin, malnourished, starving, all the way up to people who binge eat and maybe compulsive overeaters and have a hard time stopping eating. In all cases, the underlying reason behind all the eating disorders is mental health issues. Oh, wow. And so when I see clients or we see them at the Emily program, we know that almost always there's going to be a lot of mental health issues going along with that as comorbidities. It could be depression, high anxiety, OCD, bipolar. We will see people with substance abuse who often need substance abuse treatment before they get treated with eating disorders or for the eating disorders. As well, we see people who are highly suicidal, do a lot of self-harm. And so as a result of all these comorbidities that go along with the eating disorders has the highest rate of mortality among any other mental health issue. For that reason, we can all be really concerned, and it has to start with us. One, being aware of what the eating disorders are, what the signs and symptoms are and are not, as well as helping people get treatment at an early stage. The earlier they get treatment, the higher chance of having success in resolving the eating disorder. For a lot of people, it can go on for years. I've worked with people who've had eating disorders, and I've worked with them for 20 years. There's a really high incidence of middle-aged women now that we're aware of who come to us with eating disorders that never had it dealt with before, because in the past we really didn't have very good treatment. And so they're coming out of the woodwork now, and they're kind of in their 50s, and maybe they have a new eating disorder, or their old one is now arriving again, and so they're finally dealing with it. In the past, having an eating disorder has been a real stigma. Now people are more comfortable with that. But I will say that when people have anorexia, for some reason it's still a little more glamorized, and I see that people have an easier time talking about that than somebody who has binge eating or lives in a larger body. So there's still definitely a weight stigma there. And we in our field really work on trying to eliminate that weight stigma and talk about being in our bodies in a non-judgmental way. So we're not being judgmental or biased against weight, because we know that out there in the world, that's a really tough place to be when you have body size bias. So just a little bit of information. In the state of Washington, over 231,000 people have eating disorders. Since we have the biggest population on the West Coast, you can bet that a good 200,000 of them are close by. The Thurston County does every other year assessment of Thurston County students in 8th and 12th grade. Let me give you a little bit of information so that we can understand how that is affecting our young people, because that's going to be coming towards us as health professionals later. So we know now that 8th graders, females, girls, 38% of them are dieting who do not need to lose weight. 38%. When you get up into 12th graders, 46% of the girls in high school who do not need to lose weight are on diets. The reason I start with that is because about 25% of people who diet end up with some sort of disordered eating that can then turn into a full blast eating disorder. Once you're in the eating disorder, it's really takes a lot of treatment and specialized treatment to move beyond that. Likewise, and this is a red flag for a lot of us, 71% of all 12th graders who were overweight or obese are trying to lose weight. Okay, so we can say that's good, but the problem comes that so much of our dieting mentality has people diet in the wrong way, and when they're dieting in the wrong way, that often leads to eating disorders because it becomes restrictive, and what we see is when people are restricting food, they can end up with an eating, like anorexia, eating disorder such as anorexia. Likewise, very often there's a diet backlash, and after restricting, they eat a lot of food, and now they may end up with a binge eating disorder. So either way, if we have a lot of children who are dieting, we need to be there to teach them the right way to do that. And there's so much diet and food misinformation out there that we need to be really careful with our young ones, what is being presented to them. I think there's a lot we could potentially do in the schools. How am I doing on time? I didn't really look. We're okay? Do you want me to go into a little bit of conversation about the different kinds of eating disorders, or what would be helpful?
Just highlights of several of them that you might have in
Yeah,
mind.
okay.
Because we have a
So,
couple questions for you, too.
Okay, good, yeah. So anorexia nervosa is typically fear of eating, afraid of eating foods, being very restrictive, perhaps even eliminating whole groups of foods. Like, I won't eat any carbohydrates, or fats are bad, and a real intense fear of weight gain. Let's see, and I've got some handouts here too if you guys are interested in that. I'm going to skip ahead to my cheat sheet. Let's see, bulimia is a way of somebody trying to get rid of calories in one of several ways. So they may or may not be binging, eating a lot of food, or they may even be restricting, but also having the bulimia, which means like somebody who might try to get rid of calories or food by purging food out, by over-exercising. Those are the two main ways I think about that. And there's a high percentage of women and men who have that. And then there's binge eating disorder, eating a large amount of food, more than normal in a period of time. Usually we say 2 hours, but what I'm seeing is people are graze binging, like just constantly eating and ending up with a huge quantity of food in, or repetitive one after the other visits to fast food places and becoming overly full, feeling very ashamed and guilty, very often eating secretly. We have a category called avoidant restrictive food intake. So think of picky eaters, like especially little kids. But if that goes on and it ends up in being a nutritional deficit for that person, then it turns into kind of what we call an eating disorder, at least in a fashion that somebody needs help to move beyond that. It also can translate eventually and over the years into a full-blown eating disorder. So we might see kids who are avoidant and restrictive of food, but they come back and come back and come back to treatment, and then it actually has switched into anorexia or bulimia. There's diabulimia, people who have diabetes, who then, for example, if they were using insulin, they decide not to take insulin because then their body doesn't keep sugar and then they lose weight. And so they're using their diabetes as a way to lose weight. So that's another form of eating disorder. So that's kind of the brief overview. Yeah.
I've got a few questions.
Good.
I'll end with the mental health piece because I think that's intriguing me.
Yeah, good.
But you talked about the youth, the 8th graders, and 38% of the girls and 46% of high school girls. Mm-hmm. And my question surrounding that is, and I'm not trying to suggest any of this information is dodgy, but there's health curriculums in the schools, of mm-hmm. course, they push. Mm-hmm. And it's trendy to go out and be running in marathons and half marathons, mm-hmm. and Fitbit machines or Fitbit watches and right. step count, all that kind of stuff.
Right.
How much is that driving young men or women to diet when we say, oh my gosh, 46% are dieting versus an eating disorder?
That's a fascinating question. It is, and of course, I don't have any data. I bet nobody has studied that, but I can only give you some anecdotal stories. And I think part of it really depends on the individual. Like, we'll say that somebody might have the genetics, which is part of what we know about eating disorders. About 50% of anorexia has a genetic component. So we might say, here's this person who has that genetic component or background component or whatever the issues are, and that the environment kind of, I hate using this term, but pulls the trigger, right? So that something like sets it off. Let's say it that way. That's a better way to say that. And so it could be, and I've seen it, that people have done health classes and they're talking about, eat low fat, and that's triggered it. Or let's record all our calories. That's triggered it. And I think a lot of that is we need to make sure our health teachers are teaching the right way, not their personal perspective, but like science perspective. So I know that that happens. And on the other hand, you know, we don't know. I mean, that person was kind of triggered and ready to go for the eating disorder. It sounds like, and one comment, even from a coach, can send somebody into a kind of a whirlwind tailspin.
Okay, and do you have any idea the percentage of minors versus adults that have eating disorders?
I probably have them somewhere. No, but there's probably about 10 million, and that's kind of an old statistic, women. And so I don't have it on like teenagers and how many.
Okay.
Yeah, but we had run a full program where we had a lot of teenagers coming in. We have a different way of approaching that now, but we see a lot of teens, and they're out there, yeah.
Thank you. And the final one is I've never heard it put where mental health issues can be like a co-occurring disorder with eating disorders. And with the medications that are out there, some cause weight loss and others cause weight gain.
Yeah.
So with the medication that's used or prescribed for people with mental health issues, is that does that exacerbate or cause an eating disorder? Or could it?
I mean, I guess
Do you know?
it could if that individual wasn't prepared and had some other things that kind of, like I said, triggers that eating disorder to crop up. So it may and it may not. I don't think anybody can predict that even. So, you know, we'd want to support those people who that did trigger an eating disorder or find some, you know, I know the doctors and the nurse practitioners work well with finding the right medication combination. But even our own clients, we have a nurse psychiatrist on our staff, and, you know, we'll be seeing weight changes. And so we have them go back to her and trying to assess what the best plan is.
Okay, thank you, Lori.
Yeah, you're welcome. Good.
Commissioner? On, or is this is on?
Yeah.
Okay. So I have a couple of questions.
Okay.
Can you comment, and may not be a brief answer, how an eating disorder may affect ability to conceive and carry a child?
Fascinating. So we always think when somebody doesn't have their menses or they're really super thin that they will not have a pregnancy. Not so, because I've seen it. I've seen people women at their absolute lowest weight they've ever been, the most malnourished they've ever been, and conceive. Fascinating to me.
And what happened?
Oh, well,
with the fetus.
Yeah. So fortunately, in this case, they were in my care. So what I really ended up doing is I had one woman who was living on Ensure, you know, the food meal replacement, and got her through a pregnancy well. And baby was fine and doing well currently. Had some real teeth issues, like teeth falling out, just kind of crumbling as a young adult. So I think that was the effect of her not having enough good nutrition, calcium, and just not, the baby couldn't have enough to like even develop the secondary teeth. But otherwise, kiddo's pretty good. Wow. Yeah, no, lucky.
One more. What's the long-term or prognosis?
For eating disorders in general? We see a lot of people having to do treatment over and over, and it's variable. I think we say, I wish I could remember the statistics, sorry. I don't want to give the wrong statistics. I'm not going to. Play it safe. Fair enough. Yeah, and we do see a lot of good success, and we see people struggling for a long time.
Just one question for me, and kind of general assistance. Is there agencies or organizations out there that you've seen, not only yours, but that help out? Do they go to the emergency room? I don't know. I mean, how does one get involved in helping themselves?
Yeah. How to treat eating disorders in kind of an emergency way is not well known. I like to educate doctors and have doctors educate doctors as well as possible. We do have some agencies that help get people into treatment, and BHR is one of them.
BHR, sure.
Yep.
Okay, great.
Thanks.
Any other questions?
No. enough for Lori, but it's nice to see you again, Leslie.
Yeah.
After we did an interview bit down at the farmer's market last summer. Thank you.
Yeah.
Nice to see you.
Thank you so much, Lori. So the next item we have on our agenda is Mr. Mark Freeman. He's from the CEO of Thurston Mason Behavioral Health Organization, and I asked him to come talk about seasonal affect disorders just for a few minutes.
Just for what?
A few minutes.
A few minutes.
Yes.
I'll time myself.
Yes.
I can start with eating disorders, if you like.
Okay.
The BHO does end up funding extreme cases when there's a danger to self because of the extent of this disorder. And in terms of there's some specialized residential treatment also. So it can be incredibly crucial for some individuals. So I was asked, excuse me. Good afternoon, Commissioners. My name is Mark Freeman from Thurston Mason BHO, and here to talk today about seasonal affective disorder, which is really talking about one aspect of depression that we work with. There are multiple types of depression for all different types of age groups. Seasonal affective is a very specific one that essentially the individual's reacting to lack of light. It's not about cold weather. It really has more to do in that focus with the absence of life. Excuse me, that would be depressing too.
Yes,
but with light. The statistics say about 500,000 individuals suffer from it. It tends to be a family trend, and more women, almost like 1 to 8, suffer from it than men. But when talking about seasonal affective disorder, it is still when in the middle of it, it's on a continuum. It can be mild, but it also can be extreme. When dealing with this time of the year, from fall to winter, especially in the Northwest, I'll be done by the time you get that on. Especially in the Northwest, and the lack of light that we have, this is something that we end up having to deal with. But there are also multiple other types of depression that come in play. Depression deal with holiday grief. There's depression dealing with almost like cabin fever. There's a number of different things. So the kind of bottom line of seeing somebody who is depressed, who is having trouble just living daily life skills, helpless, feeling hopeless, multiple things, I would encourage that person or to recommend them to go seek an intake, get an assessment, talk to a professional, and to obtain some help. Because when you're in the middle of depression, it's very hard to pull yourself out, and that includes seasonal affective. There are light treatments. That by itself is probably not sufficient, and it should be coupled with other types of treatment. But one of the things that's crucial is things like keeping your alcohol intake down, especially during the holidays. That all has an impact on it and impact the ability to manage your depression, as well as if you are on medication, coupling that with alcohol can be dangerous for yourself. So to keep this short, or unless you want me to go further into it.
A few more minutes, yeah, sure.
Okay, so let me talk a little bit also about dealing with this time of the year when we talk about fall to winter. We have the problem with lack of light, but we also have the issue with holidays and people responding to significant events in their life due to holidays. And what I talk about reacting to is that holidays, and as you heard before, there are cues or triggers that it can suddenly impact somebody that brings up an old issue or the recurrence of something. And when you deal with holidays, that's a major trigger for a lot of things, particularly when you deal with grief and loss. And so during this time when we're dealing with issues like lack of light and hopelessness and helplessness that can kick in, you're also dealing with other kinds of issues related to grief and loss that come up this time of the year. And again, this is something that it can be recurring. Getting treatment, though, is essential because sitting in the middle of something like that is extremely hard, and often you can't pull yourself out. So would, under all circumstances, recommend that individuals seek an assessment. If they don't know where to go, I would call there are a couple of options. There's a recovery helpline, and their phone number is 866-789-1511. And there's the crisis clinic of Thurston Mason counties at 360-586-2800. And you can also call the BHO customer service line if you are unable to get through to some of these other sources. And that's at 360-763-5825, or our 800 number at 800-658-4105. So calling these numbers will try to help, or the agencies will try to help direct you where there is some assistance. And ultimately, if you're in an extreme situation, call 911. If you're in an emergency, if it's acute and you're at risk, don't hesitate and go to 911. And they're incredibly helpful in trying to see you through any of these issues, from dispatch to the officer on the street. Any questions?
No, thank you very much.
No question, but a comment.
Sure.
You mentioned light and lightage or light bulbs can help. And in my kitchen, we have about 10 of the fluorescents, and I buy the. It's not ultraviolet, but it's the it like mimics
full
sunlight.
spectrum.
Full spectrum lighting, yeah. And boy, it just changes everything in the house.
It does have
Wife and kids, it's just amazing the difference.
Yeah, and I know individuals have those fixtures in their offices. That helps, especially nowadays when we have a lot of offices that are not anywhere near a window, and if you're embedded inside someplace, doing something to pull in. And again, it's not just any light bulb that's going to make a difference.
No.
It is, look, you need to study and get what's correct for that.
Yeah.
Well, I'm glad that's helped.
Good stuff, yeah. Thank you, Mark.
Sure. Anything else?
Thank you very much. It's very informative, and appreciate y'all the work you do.
Thank you. Appreciate the time.
So next we have on the agenda is Thurston Thrives, and I've asked Liz Davis today to come give us an update on the Thurston Thrives Coordinating Council. Liz is the staff and the primary coordinator, and she has some things to tell us.
Hi, good afternoon, commissioners.
Hello.
Nice to see you as always. I'm just going to provide a little bit of context for people who may be watching, and then tell you some of what's going on this year. So as you know, Thurston Thrives is our community health and safety initiative. It was founded by the Board of Health in 2013, which means that we are now celebrating 5 years, which is very exciting. We're also celebrating 3 years as a public-private partnership. So in December of 2014, the board voted to transition the initiative from a county-based initiative to a community-led partnership. And since that time, the Thurston County Chamber Foundation has been serving as our fiscal agent, so we're very grateful to them for doing that. Financial donors include the county, also the United Way of Thurston County, the Thurston County Chamber, and the Chamber Foundation, Wells Fargo, and the Community Foundation of South Puget Sound. Over the past 5 years, we've had literally hundreds, if not probably even over 1,000 diverse cross-sector partners come together to work on public health and safety together, including businesses, nonprofits, representatives from state and county and local governments, as well as private citizens. And they've all been working cooperatively to ensure that Thurston County is the healthiest possible place to live, work, and raise a family. They've been working in various action teams focused on ensuring that we know as a community that health is more than healthcare, and that we have to work on all sorts of areas in order to improve health. Those include clinical care and emergency and disaster preparedness, community design, our economy, education, and also child and youth and community resilience, our environment, including climate and clean energy, food, housing, and also public safety and justice. We had a fantastic year-end meeting a couple of weeks ago of the Thurston Thrives Coordinating Council. All of the action teams shared sort of year-end updates on what they'd accomplished throughout the year. It was really inspiring to see the way that all of those people are coming together to accomplish things in our community. We have an exciting year ahead. There are going to be quite a few membership transitions on the coordinating council, and now that it's been about 2.5 years since we really launched the coordinating council, which is kind of a steering committee of this collective impact initiative, and our governing principles say that we need to, operating principles say that we need to start rotating out membership, and some people are choosing to move on to other things as well. So there will be some fun transitions there, and so it'll be fun to have new leadership in that body. We're also going to be launching our Community Hope Initiative. We've been working on this internally for a long time, but we got some seed money from the Community Foundation. We're very grateful to them for that. They've given us $10,000 to launch the initiative, so we're going to be working on that, not only with internal partners, but debuting some things to the public. Also, on March 22nd, many thanks to Commissioner Blake for hosting an Action Team Nexus Summit, which is going to be held at the Thurston County Fairgrounds. And we're going to be focusing on trying to find areas of synergy between our 8 action teams and also our shared work groups on how can they work together on issues that they collectively care about to move out of sort of more siloed topical actions and be able to accomplish things together. So we're hopeful that that will not only bring about some more collaborative projects or initiatives, but also more collaborative action on existing projects and initiatives. So we have an active community design forum coming up on March 7th, which is exciting as well. And we hope to have some other announcements for you soon. That's just a teaser, but you can expect for some positive things to be coming your way. We are so grateful to the board for launching Thurston Thrives, to Thurston County Public Health and Social Services for their leadership of this initiative over the past 5 years, and particularly to Chris Hawkins, Community Education, Evidence, and Partnerships Manager. I always have to look at my notes for that, who has been really an incredible leader of Thurston Thrives from the ground floor, from the very beginning. And also to our hundreds of community partners that have been cooperating on this. We're very enthusiastic about the year ahead, and we'll continue to provide you with monthly updates. And thank you for this opportunity.
No, thank you very much. Thanks for what you do.
Yes, and I love the fact that it's community-led, not just county-led. That's beautiful work. Thank you. Thank you, Liz.
Yeah, thank you so much for the update. Look forward to the 2018 and coming back and giving us periodic updates on teams, coordinating council, and some of the results of that things you mentioned.
My pleasure.
You bet.
Thank you very much.
Okay, so moving along in the agenda, we're at item number 9. And so I mentioned earlier when I did the introduction, Dr. Wood is the health officer for Thurston County, but she's also for Lewis County. And I'll let Shelley Slaughter give a little bit of background on the next action. So.
Thank you, Commissioner. Is this?
Nope.
Yeah, okay.
Hers.
All right.
You'll still have to speak louder, though.
Okay. Can you hear me?
Yep.
All right. So you held a special Board of Health meeting on December 6th, and one of the items that you approved at that meeting was approving a health officer services contract with Lewis County, which would appoint Dr. Rachel Wood as the local health officer for Lewis County. That contract was to provide health officer services for the duration of January 1st, 2018 through December 31st, 2018 for a total compensation of $41,615. At that time, the Lewis County Board of Health did not approve the contract as written because they requested some minor revisions. So we bring this back before you now. This is a request to approve a revised contract with Lewis County to provide health officer services, which would commence upon the date last executed and would remain in effect through December 31st, 2018 for a total compensation of $45,464. This contract requires 8 hours per week of Dr. Wood's time. And each year, these services and hours are evaluated before considering continuation of the contract. And all parties agree to this contract at this time.
Questions of Shelley?
No, I'm ready to.
And Lewis County's already said okay.
They have not approved it yet. This item will be on the February Lewis County Board of Health agenda, but their legal review and their director and their board has preliminary approved the revised language.
Okay. So I move to approve and sign the revised Lewis County Health Officer Services contract for the duration of January 1, 2018 through December 31, 2018 for a total compensation of $45,464, and authorize the Public Health and Social Services Director to sign amendments to this contract that do not revise the compensation or duration of the contract by more than 25%.
Second.
It's been moved and seconded as stated. All those in favor say aye.
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 Aye, and so your motion carries, Shelley.
Thank you.
And so the next item we have on the agenda, item number 10, is for Mr. Art Starry to kind of give a quick overview of some of the legislative priorities within the 28 Public Health and Social Services for the year of 2018. And so, Art, how you doing? It's good to see you again.
Oh, pretty good.
Give us a little bit of a rundown.
Okay, so as Commissioner Blake indicated, I'm Art Starry. I'm the Environmental Health Director for Thurston County Public Health and Social Services, and I'm here to talk about legislative issues. Also here is Gary Aiden, in case you have questions about maybe some of the housing-related things that would be on the that might be coming up. And so one of the things that I do besides the Environmental Health Director is I work with the Washington State Association of Local Public Health Officials on their legislative committee. And so I guess I have the dubious distinction from their perspective of being the ledge co-chair. So I've been doing that for quite a while. So one of the things, though, that happens is that as you know, the legislature comes in session every year. It started yesterday, and there's a variety of bills that get filed and budget actions and things that affect public health. They affect social services. They affect housing and other things that are of interest to the department and to the county. And so staff are asked often to provide comments and to review bills and to provide feedback to associations like WASALFO or the Washington State Association of Counties or other professional organizations on the bills. And each year those groups also come up with legislative priority lists or agendas, things that they think are going to be coming up that they try to get established positions on, and they also ask us then to work on as the opportunity presents itself. So what I've attached is a couple of things, and I can go over them in as much detail as you'd like or as little detail as you'd like. And they are the legislative priorities for some different organizations that we're affiliated with or associated with. One is WASALFO, the other one is the Washington State Association of Counties. We've also attached some notes that Gary helped provide regarding some priorities for the housing program, and excuse me, there's also I'm choking up, the Association of County Human Services. I don't know what I did there. Yeah, I don't know. So and so those are the things we'll be looking at. What happens, though, in practice is that when we're asked to comment on things, we can provide information to those different work groups, and if the legislature or legislative staff come and ask us for information about how these bills might affect us at Thurston County, we provide that information as time and resources allow. But if it comes down to where the county, where we're being asked to testify on a bill or represent the county, there's a process that we follow for that. And that is to make sure that the county manager and our director are aware of those things, and that we actually then make sure that the board is satisfied that we're the appropriate people to talk on issues, and that the position that we're taking or the points that we're representing are okay. So that's a process that goes on, because as you know, you're actually the only people who can speak or authorize us to speak on behalf of the county. I can't do that as a county department person or as, oh wow, thank you, Chris, you're too nice. And so that's the process we go through. So I just wanted to let people know that as well, so that sometimes if they see me up there or see one of our staff up there, it's because that we've been authorized to do that. We can't represent the county just on our own. So what I will do is talk about a few things that are likely to come up that Wasalfo and WASAC have identified, and let you kind of know what our concerns are, not knowing for sure exactly what the legislature will be doing or exactly how these things might come up in bills, but to let you know some of the issues that are there that, again, that we've identified. So far, so good?
So far, so good.
So speaking from the Wasalfo legislative list, one of the things that was worked on last session that's still really important to us is something called foundational public health services. And last session, the legislature was kind enough to provide some funding for local public health. And what that's being designated for is things like communicable disease, emergency response, those sorts of activities. And so again, we're very thankful for that, but the legislature said very clearly that this is a one-time allocation. And they provided about $12 million when the Department of Health thought that really the initial payment ought to be about $60 million. And so it's very much appreciated. It provides about $150,000 a year to Thurston County. It's not really nearly enough, and if you were to look at the different activities that we're supposed to be doing and the level that we'd like to do them at, it's the $150,000 doesn't really cover, it's kind of a drop in the bucket. So one of the things that Wasalfo will be doing, and that WASAC actually has also adopted as one of their legislative priorities, is to continue to advocate for foundational public health services with the hopes that if the legislature continues to understand and appreciate that, if there's a request in the future for additional funding for public health, like next legislative session, that they'll be supportive of that. And that would then help us do our jobs, and would also help the county, because it would then, possibly make funding available for other county programs. You wouldn't maybe have to devote quite so much to the health department for some of these actions. Another big thing, which maybe people don't necessarily think is a health department issue, is the capital budget. People are wondering, well, why does the health department carry about bridges and schools and things like that? Well, we do, but really the reason that we're interested in this is because it provides funding for some of our grant programs. There's something called the Consolidated Prevention or Coordinated Prevention Grant. It's now got a new name called Local Solid Waste Financial Assistance. But that provides several $100,000 a year to the county, both in terms of the health department and public works, for dealing with solid and hazardous waste issues. And because the capital budget hasn't passed, we're not receiving those monies. And frankly, the health department, we're struggling about what to do about that. We've managed to get through 2017, but in 2018, if we don't get these grant funds, we're going to be struggling to deal with solid waste enforcement issues to provide the assistance that the public likes. And that elected officials also appreciate, because you get the phone calls when we're not able to respond to complaints and to evaluate issues as promptly as people would like. There's also, we anticipate legislation on the opioid epidemic and the issues ranging from, I will take some of the water now, safe medicine to return, to trying to deal with how prescriptions are monitored, to trying to deal with how much medicine can be provided in a prescription of opioids when they're first coming out, those sorts of things that Dr. Wood could probably talk a lot about. But there are a whole variety of issues on opioids and things that we anticipate coming up, and we would support trying to have more management tools and trying to address the opioid epidemic. There's issues that come up periodically with that kind of challenge the authority of the local board of health and the local health officer as far as how they manage things. And there's actually a relationship between that item and one that deals with septic systems, for instance. There's a bill that's coming up on Thursday that would restrict whether or not what the local board of health could do as far as requiring people to how they would go about managing their septic systems. So some of the strategies that we've used in Henderson Inlet and Nisqually Reach might be hampered if that bill were to pass. And so those are the sorts of things that we track. There's always something to do, as people who've listened to me before, there's always something about septic systems. It seems like whenever you want to get people upset, you talk about septic systems and money, and then that usually gets the legislature involved. There's also likely to be bills on food code safety items. There's a couple that we're anticipating, as well as trying to do a better job of limiting tobacco to people. There's something called Tobacco 21. That there's evidence that suggests that if the minimum age for being able to acquire tobacco products is raised from 18 to 21, that actually has a significant positive impact in reducing the amount of cancers that are result. If people have less access when they're younger, they basically reduce their the use and basically becoming, I guess, addicted to tobacco products. And so that's something that's also likely to be coming. Other things that are coming that we expect that we might be asked to comment on is it's listed in the WASAC priorities as something called Rural Water Solutions, otherwise known as HRST. We know that something will be happening on that. Sometimes local health gets asked to participate in the review of those sorts of bills and provide comments, because depending upon how jurisdictions manage that, sometimes the health departments get involved. If you look at some of the strategies that different counties have used and that are being advocated and through some of these bills, there might be a role for the health department, because after all, you need water, clean water to be healthy, but you also need adequate water to deal with the water resource issues. And you'll also see, if you look at the WASAC sheet, that foundational public health services has been adopted as a priority for this Washington State Association of Counties. One of the other things, that I'll mention this briefly, and Gary could provide more details, is that there's a bill that was filed last session that didn't pass, but it is still active because of the way the legislature works. As you know, maybe the public doesn't know, is that a bill that's in a 2-year legislative cycle, bills that are filed the first year, even if they're not passed, they come back to life when the next session comes about. So all those bills that were filed in 2017, they're still alive in 2018, even if they weren't passed. And one of those bills has to do with trying to increase the document recording fee and making sure that it never expires. So those funds are used to provide funding for housing programs. And again, Gary could talk to you more about that if you have questions, but that's something that is of interest, certainly to us, because as you know, one of the key things for public health is to have good housing. If you have a roof over your head, you're more likely to have be able to be healthy, be able to ward off diseases and things, because you're not wet and cold and you know where you're going to stay. There's other bills as well. So I feel like I'm kind of rambling, but those are kind of some highlights of things that are going on.
Perfect.
We anticipate, again, who knows what the legislature will bring. These are some things we've identified in advance, but just as I'm standing here today, I know we'll be surprised by a couple of things that no one anticipated. And as we become aware of those, especially as they affect the county and they affect the health department, we'll bring those to your attention and bring them to the attention of our partners at WSALFA and WASAC and others, to see if we can provide information and work to make sure that the legislatures have the best information possible when they decide what to do about these things.
All right, thank you, Art. Especially with the short session, won't be with a short session across there. We probably won't see a lot of action.
We probably won't see much, but then you never know. Sometimes if they get hung up on what people who've been doing this longer than I have, they say sometimes that what happens when they struggle with things like budgets and they can't make progress on that, they go and work on some of these other bills so they can keep busy. So, but we'll see.
No, thank you very much.
Thank you very much. Awesome job, as usual.
Okay, and one thing I was going to mention, I wasn't able to donate blood today, but I do donate blood regularly, and they mentioned the thing about signing up for emails. If you do that, you can be pretty much assured that every 8 weeks you're going to get a reminder to go and donate. And they've done that for me pretty well, so it's a neat program.
Okay. Thank you, Art.
Okay, well, thank you very much.
Mm-hmm. So I'm going to move on to number 12, which is the director's report, and see if Shelley has anything to say about what's going on in public health and social services.
I have lots of exciting things to share. So good afternoon. I wanted to say thank you again to all of our amazing staff and presenters that were here today. I know many of them had to leave, but it's always really inspiring to get to hear what everybody has to say, and it's really incredible. And we do a lot in this community in Thurston County Public Health and Social Services, and we don't do that alone without partners in our community. So thank you. Lots of things going on, both locally, statewide, and regionally. So as you just heard from our esteemed Art Starry, we're gearing up for the upcoming legislative session, and there's a lot of things going on that Art just outlined, and I just want to call out some extra kudos to Art. He is the co-chair of the legislative committee for WSALFA, which is our statewide association. So not only do we get called on a lot being in Olympia, but also people look to our department and specifically to Art for leadership around this issue. So I just want to say thank you to Art for that, and we really need a lot of advocacy this year. So Art also mentioned Foundational Public Health Services and the $153,000 that we were awarded last year for Foundational Public Health. I just wanted to share a little bit about how we are using those funds and what that means to us. So right now we are intensively working on an assessment that we are submitting to the consultants and to the state to make a future request for additional foundational public health dollars. That's really essential. It really outlines everything that we do every day, what we are responsible for doing, what you as a board do, and what we as a county have to do. And those, I think a lot of people in the public don't know how critically needed these services are. For our pilot project for the $153,000, we're targeting our funding on sexually transmitted disease investigation and follow-up. Our state decided to focus on that particular area of infectious disease so we could measure our collective impact on focusing on infectious disease. Every community got to choose what they locally wanted to participate on, every county did. And so we're focusing on reducing the number of infections of syphilis, chlamydia, gonorrhea, and HIV. In addition, this funding supports our emergency preparedness and response work related to planning around infectious disease. Many people don't know how much we are responsible for and our role in emergency preparedness. If there's a bioterror or disease outbreak in the state capitol, we're responsible for that. We were also involved in supporting the train derailment disaster last month. We heard about that earlier, and we activated, along with Thurston County Emergency Management, our Emergency Operations Center and Incident Command, and worked closely with our partners in Pierce County and our federal and state partners around coordinating patient transfers to local hospitals. In Thurston County, we had 29 patients that were treated at local hospitals and healthcare facilities, and I just want to say thank you to everyone who worked together to support the victims and their families and all the first responders that supported that incident, including our staff, especially our emergency preparedness. They trained for this every day, and they were ready to respond, and our whole department just rallied around supporting that event. So in other regional news, as you know, I represent Thurston County on Choice Regional Health on the board. Choice Regional Health is the fiscal agent for our Accountable Community of Health Cascade Pacific Action Alliance, of which Commissioner Blake represents Thurston County and Thurston Mason BHO on. And I've been updating you over the last, probably 6 months or so on progress for the transformation project, and I'm happy to announce that Choice and the Cascade Pacific Action Alliance did successfully submit their application to the state for up to $85 million in new Medicaid funding that will come to our community and our 7-county region. The project areas include opioid response, chronic disease prevention, access to care, maternal child health, and other programs. And we hope that these dollars will begin to be made available to our local communities to demonstrate success by early June. In other regional news, we continue our efforts to strengthen our tobacco prevention in the 7-county region. We are the lead for that. We have one of the higher rates of tobacco use among youth in our community compared to others in the state. So this is something that's very near and dear to our hearts, and we really want to move the needle on that. We've completed agreements with 4 of our 6 other health departments in our region. We're planning to get hopefully all of our other 7 counties on board with us on that, and rolling out some exciting and innovative new youth prevention programs on tobacco use. We are also continuing to support strategy development for youth marijuana prevention across the region. I think I need water too. My goodness, so much to say. In environmental health news, bat season's winding down. Staff responded to 64 bat bite reports this summer and fall. 30 samples were sent to the state lab for rabies testing, and happy to announce that none of those tested positive for rabies in Thurston County. During the rainy fall season also, we had some high fecal coliform bacteria levels in several creeks, including Indian Creek, Blooms Ditch, Black River, Scatter Creek, Prairie Creek, Beaver Creek, Skookumchuck River, so lots. That just demonstrates how much work our staff are doing all the time and making sure that we have safe and clean water all over Thurston County. Continue to investigate that. Also, dye testing has begun for high-risk septic system in the Henderson and Nisqually Shellfish Protection Districts. Unfortunately, in not so good news, Environmental Health has stopped our financial assistance program for the septic system riser rebate program and the low-income maintenance repair grants. These programs assisted the public with upgrading their septic tanks with risers for easier access for maintenance, and the grant program aided the public in maintaining and inspecting their septic systems in order to renew their required operational certificates in marine recovery areas. These funds for these programs come through the Conservation District, and they did not finalize their budget for 2018. As of today, no lakes are under a toxic algae advisory, so we're very happy about that. But we did have, over the last couple of months, it's been a couple months since we had our public health meeting on camera here to share about our toxic algae blooms, but we did have a toxic algae bloom that was visible in Summit Lake and found high levels of microcystin that were a threat to young children, pregnant, and nursing mothers, and Dr. Wood had put an advisory on the lake while we continued to test for that. Fortunately, that resolved, and we continue to work with that community to make future plans, as that is the source of their drinking water. We also had algae bloom in Offutt Lake, but that also cleared happily in time for the New Year's polar bear plunge. So people got to jump in and have a lot of fun and celebrate the new year.
Yeah.
In our Developmental Disabilities and Veterans Assistance Program, you heard from Mark earlier. So interviews have been conducted for our new staff position at the Hub. We'll be excited to, that position has been offered, and we'll be excited to bring that person to introduce to you either at the Board of County Commissioners or the Board of Health in the future. But just the Veterans Advisory Board helped support in the interview process for that, and together everyone's working amazingly at the Veterans Hub in Lacey, and every day we're providing services to veterans. So in this last month, 14 veterans were scheduled for appointments. 8 met the requirements for funding, and 49 were helped through phone contact and lots of resources. In our Special Recreation Department, we've heard from our amazing Margaret that helps those with developmental disabilities get to enjoy life through special recreation, and this time of year is lots of fun for them. They got to go to Zoo Lights at Point Defiance Zoo. 20 different people got to go. The winter program brochure is out, and so anyone who wants to look online and see what kind of great programs that we have, there's a trip to the AKC Dog Show, a trip to Pierce College Science Dome, and lots of other things. So we've almost reached capacity, but we're always looking for new clients that want to come and join us on those really fun trips. In our Nurse Family Partnership program, we have executed contracts with Lewis and the Department of Early Learning to launch our regional partnership, which began on January 1st. We're really excited about this. We were able to add 4 additional nurses to our staff who will serve both Mason and Lewis County now. And I just want to take this opportunity to extend my great thanks and appreciation to Lewis County and to Mason County for this regional partnership and for their leadership, which will help pregnant, young, and at-risk mothers throughout Mason and Lewis County and their babies to access services that really make a long-term difference in their lives. We hope that that will help retain more amazing, high-quality public health, maternal child health nurses, and increase our funding capacity so we can serve even more families in our region together. In that same vein, we were fortunate to have the opportunity to take Congressman Heck out on a nurse home visit with us, and we really hope that federal funding for home visiting will be preserved so we can continue to serve even more families. A lot of people don't know that we also administer vital records here in Thurston County, and so that's birth and death certificates that we have available to issue. So if anyone needs birth and death certificates, they come to our office at Lily Road. In the month of December, we issued 254 birth certificates and 229 death certificates. In housing news, I'm almost done. The fiscal year 2016 Consolidated Annual Performance and Evaluation Report, also known as the CAPER, was completed and submitted to HUD, as was the Fair Housing Plan. Unfortunately, the Fair Housing Plan is not being evaluated by HUD over the next 2 years per presidential recent decision. However, there was amazing work that went into that to ensure that those in our community have fair and equitable access to housing. And I thank everyone on Olympia, the Housing Authority, and on our Board of County Commissioners that participated in that. Work continues to identify our local regional partners to help the cold weather shelter program. Chairman Blake has been leading the cold weather task force and developing a cold weather response plan for our community. There's been many amazing partners that have been at the table working on that to ensure that we have adequate shelter during both emergent cold weather as well as seasonal cold weather. As you heard at the Board of County Commissioners meeting earlier today, we had a speaker during public comment, Faith Adicott, who talked about the annual point-in-time count, which will be conducted on January 25th. This is our annual homeless census, and volunteers are needed to count those who are without permanent housing in our community. People who might be interested in signing up to help go around and meet those in our community without housing, find out more about their situations, and help us gather data that will help us to tell the story that we need to our funding partners, state and federal, and help us address community gaps that are much needed. Our staff continue to investigate and follow up for reported and suspected cases of mumps and pertussis. We started to receive reports of influenza. I expect Dr. Wood's going to cover flu, so I'm not going to say anything about that. But another exciting possible development is the Washington State Department of Health has asked if they might be able to use some space to conduct investigation and follow up with Thurston County residents, specifically with HIV. Since we bid farewell to our amazing VHO, we have some additional space available at our building, and so we're looking into that. The syringe exchange program continues to see an alarming increase in the number of syringes brought in for exchange, and we struggle with being able to sustain those services. I think that it is a sign of the opioid epidemic that is impacting us here in Thurston County. We are expanding our mobile exchange, and I'm happy to report that the mobile exchange is going to be operating in the Steamboat Island area in about 2 weeks, and we continue to look for sites in both Rochester and Yelm so that we can reach our other people in our community in the rural areas and on our neighboring county borders to ensure that they have access to safe needles and resources for disease prevention and treatment. Our staff, in conjunction with the Medical Reserve Corps, completed 2 offsite influenza immunization clinics for homeless and uninsured and underinsured populations. And I believe Dr. Wood will be sharing more about influenza and any MRC other activities. So that's all I have, unless you have any questions for me.
You mentioned Indian Creek and then the point in time count coming up. Was Indian Creek, was that with the algae bloom?
No, that was high levels of fecal coliform.
And that's in town, right? In Olympia?
I believe
Yes.
so.
Yeah. And the point in time thing, that kind of comes together, those 2 issues, because there's a homeless camp on Indian Creek with about 100 people in it that have no septic facilities whatsoever. Are you all aware of that? Yes, I would like to hear something more about it.
Yeah, so one of the, once again, this is Art with the health department, and when we get those sample results, then one of the things we try to do is follow up to figure out what the source of it is. And so if there are homeless issues or failing septic systems or improper sewer connections, we try to figure things out to identify what the source of the pollution might be. And yeah, there are a couple of actually watersheds within the county where we have homeless camps that could be or likely influencing the water quality.
I guess I would suggest that you not spend a lot of time trying to chase down homeowners' septics when there's 100 people living on the creek itself with no systems.
Yeah, no. So we try to look at the right things and spend the time where it's warranted rather than we don't have time and effort to waste.
And then who might know about the Skookumchuck River and Summit Lake? Those are both issues where we had problems apparently. I know about Summit Lake one. What happened on the Skookumchuck?
So just as part of our monitoring programs, we take water quality samples, and when we find out that the results are high, then we try to follow up to see if we can figure out what the source of that was or what the problem is. So I don't know the details of the Skookumchuck, but I can talk to staff and get back to you on that if you'd like.
Oh, I would like to have you look into that because the headwaters of the Skookumchuck are in that same area where the industrial application of nitrogen takes place every year to the tune of about 200 pounds per acre in thousands of acres.
Right.
I'd like to see if there's a correlation.
Yeah, so I can check with staff on that to see whether or not the type of fertilizer might be contributing to the bacterial problem. A lot of time, I don't know the history or the land management strategy there, but that's something I'll check with staff on and get back to you.
And Summit Lake is also a spring-fed lake, and it also could be very well affected the same way because of the timber industry all the way around that lake also fertilizes with helicopters to the tune of about 200 pounds per acre. And I think that ends up coming into the lake, and I'd like to know more about that. And I think the public would like to know more about that as well.
Okay. Okay. Thank you.
No.
Neither do I.
Okay, thank you. Dr. Witt?
Health officer.
Yeah. No, this is it, right?
Yeah.
I'm getting a little confused. So, yes, thank you. So influenza is here, and we had amazing partnership with many different people in the community and in surrounding counties to make a joint decision to institute masking for healthcare workers who either cannot or choose not to get the influenza vaccine as one more level of intervention to try to prevent the spread and for the sake of safety for staff and for patients that use our healthcare facilities. So, yes, it appears that it's going to be predominantly a year in which the influenza A H3N2 version of the virus is is predominant, and in the past that has been a somewhat more virulent virus than actually the H1N1 influenza A virus. So we will see how that goes. There's been conversations about how well the vaccine works, but it's the same composition as it was last year, and the efficacy of the vaccine was around 32% last year. So despite discussion to the contrary from our neighbors in the southern hemisphere, we anticipate the vaccine is a good preventive measure to prevent illness, hospitalization, and death. On another infectious disease matter, we have 2 new individuals who have been diagnosed with tuberculosis that have presented for healthcare in this county, and we will be working with our partners to manage and to investigate contacts to those individuals to see whether the infection was spread from those individuals. I would like to say that partnership on the opioid crisis continues. I've been involved with the Washington Academy of Family Practice and the Washington State Association of Local Public Health Officials have got together a couple of years ago to look at some common interests, the low-hanging fruit, and the opioid situation is one of those areas. We're still finalizing exactly what we will be doing as a group, not wanting to duplicate efforts. There's many efforts going on with CPAA and other entities, so we want to do some focused intervention. between those two groups, and the other low-hanging fruit was immunizations that the two groups decided they wanted to work on. So, and that's about it, unless you have any specific questions for me.
Here it is.
Yeah. Oh, okay, good.
For those folks that maybe can't afford a flu shot out there, what would be the best mechanism for them to use to try and get that done if they don't have the proper financial ability or insurance or what can they call you, or do we have a program in place that can help them out?
Well, we worked on a document that we released to the schools, certainly for children, and I don't have that here in front of me, but it has to do with how to apply for health insurance and how to get somebody maybe to negotiate, the health plan finder, and then how to find somebody who would provide the immunization. Children should be covered if they're uninsured or underinsured by the Vaccine for Children program.
Almost because of timing being of the essence, I guess I'm wondering about, is there a phone number or something that people could call that could maybe, they're not through the school, maybe their kids aren't in school yet. I don't know what their situation is, but somehow to help out.
Within Reach has been an excellent partner. They actually have put on some of our immunization conferences that I've had the pleasure and to go to statewide. So that might be.
Do you, by any chance, have an information number that people might?
I'll see if I can Google it right now because I don't have it at the top of my head.
Okay. If you get it, it might be worth putting out to folks. If we're in the season, I guess now's the time to try and address it for those folks that don't have the resources. The other thing is, and have we got a time frame on the opioid? What we're going to do as far as making a declaration there's a problem so we can track some of those prescriptions, and where are we at on that?
We're scheduling a briefing with you. We're going to try to get in this week or next week with you to talk more about that. So at next month's Board Health meeting, we should be able to talk more robustly about opioid crisis response.
Great, thank you.
Yeah, I just a comment that on kind of an off-the-ball question for the doc. This Board of Health, we do have a real keen interest on doing something proactive with opioids. But I don't know if you're up to speed because it's more veterinary medicine, the EHV-1, the equine herpes.
I don't know about it.
Okay. Because humans can't contract it apparently, but humans are passing it by saliva and such of the animal to other animals. And I didn't know if you knew anything about that.
I'd be happy to look into it. I don't know anything about it.
You'll do what I do, then I'll probably go to the Google. Thank you, Doc.
Any other thing?
No.
Okay. Well, that brings us.
I guess one, maybe, how about a health department phone number for somebody?
Oh, yes.
Well, no, not, maybe the doctor doesn't have it right on hand, but I'm just wondering about the health department.
What's a good number to you?
Is there an information number for the health department that they could call?
Phone number to you.
To you, to the health department. Can you get that?
911.
Yes, I'm looking at you, Lydia.
860-867-2500.
Say it slower.
Thank you.
Say it, slower and louder.
360-867-2500.
2,500.
Thank you, Lydia.
Thank you.
10 years.
All righty.
I believe
So-
the Olympia Free Clinic also has some flu vaccine available to those that are uninsured and need flu vaccine.
They do.
Okay, that was the Olympia Free Clinic?
Yes.
Okay.
And then thanks to Mr. Chavez here, I have a telephone number for Within Reach. It is 206-284-2465. That is 206-284-2465.
And that looks like one of those numbers match with, I've got it wrote down here, with the number that Mark gave out on his seasonal affective disorder. So same number, but I didn't write down the
Well, the reach is, the organization provides many different services.
Many different services, okay.
Yeah.
Okay.
Their objective is.
Well, I'm sorry I put you on the spot. I just thought might as well get it out to the public.
Reach
Cause
organizations, we make the connections, Washington families in need of healthy connections.
okay.
That's it.
I mean, I doubt very many people are watching, but somebody might have a friend in need or something.
sure.
Pass the words.
Tons
Thank
of
you.
People watching. Tons of people watching.
Well, I
Is it?
don't know. I shouldn't be so pessimistic, I guess. I should be more
That's
optimistic.
tough.
in that regard. Okay.
Alrighty, with that in mind, we're at item number 14, which is adjournment. Is there a motion to adjourn?
I move to adjourn the Board of Health meeting on January 9, 2018.
And I'll second that.
Moved and seconded as stated. All those in favor say aye.
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 We are adjourned.